Alright, so we want to actually look at another way of diagnosing lower urinary tract infections, and this one is known as a wet mounts, or you could say wet preparations. So, wet mounts or wet preparation basically is used in diagnosing lower genital tract infections. You understand? But you can also use it for urinary tract infections. Most of the times, if the infection is now involved in the vagina, okay, to be specific. So, wet mounts for urinary tract infections, the lower one, they are rapid, they are low costing microscopic technique. They are mainly used for vaginal, like to evaluate vaginal secretion. So, of course, you can have a urinary tract infection now because the urinary tract of women is not that long. You can have it coming up with like discharge in the vagina. You understand? So they can occasionally be used in identifying lower urinary tract infections when urine sediment is usually examined. So what is wet prep? It involves placing a drop of fluid, usually a vaginal discharge or urine sediment, on a slide. So with saline, you cover it with cover slip and examine it under a microscope. So it helps to just dictate microorganisms that are there and have a tendency of moving. Okay. So wet prep findings related to lower urinary tract infections: you might find white blood cells, you might find bacteria, different types of bacteria there. You might find yeast cells to now tell you that maybe there's a yeast infection coming in. You might find Trichomonas. You might find clue cells. Clue cells will now tell you that okay, there's bacterial vaginosis coming in. Okay, then epithelial cells too can also be found there. So limitations for using this in lower urinary tract infection is urine culture remains the gold standard for any lower urinary tract infections. Urinalysis with dipsticks and microscopy is more sensitive. Okay, the wet prep is more useful for vaginal infections than for bladder or urethral infections. So when might wet prep be used for lower urinary tract infections? Low resource limiting settings, when symptoms are overlapping with vaginal infections. Okay, so you can just combine the whole thing, the whole ways.